welcome to the October Self-Sufficiency Partner Meeting. I always forget to call it that, but indeed, we've got another good agenda for you with lots of different information. My name is James Barda. I am the Engagement Strategies Coordinator with the Oregon Eligibility Partnership. We are the people within ODHS that manage the one system determining eligibility for all sorts of important programs. And my co-facilitator, Catherine, is here.
Hi, James. Hi, everyone. My name is Catherine Garland. I use she, her pronouns, and I am a SNAP and Summer EBT program analyst. And then also another hat that James and I both wear is we're a part of the federal action coordination team, the community engagement people who help keep you informed of the federal changes coming. So thanks for having me. Back to you, James.
Yeah, one more thing before we I think I'm sharing my whole screen, but you get the idea of what I'm trying to share here, and that is the flyer that was attached to the agenda. I hope you all got this. And coming up, just this next Wednesday on the 15th, if you have clients or people you know you're working with who are interested in state employment, please take a look at that flyer. I have it up here now. Take a screenshot if you need be, if you don't have the flyer. But just, a good opportunity for people in these times where lots of things are changing, not always for the better. But just wanted to leave this up for a moment. And I will pause, but I see our first speaker. Claire Sequin is here to give us some important updates. So I'm going to stop sharing and turn it over to her.
Thanks, James. Hi, everybody. Thanks for coming today. Got a few really good updates for you, I think, really important ones. And I will say my part feels really pretty hard to share. And I'm going to talk a little bit about the budget update and our process for getting some feedback from you all, which I think is a really important step that the agency is taking as we head into what is a very restricted environment around budgets. You probably all know that most state agencies have been asked by the legislature and the governor to look at our programs and come up with a 5% budget cut. We will all be looking at the overarching statewide gap is about $373 million for this the rest of this biennium, I guess. But we're going to need to propose some places where we think we can make cuts as a part of an exercise. So all of the agencies will be doing this together. Part of this is because of the state budget shortfall. And the other part, candidly, is some of the federal implications that we have of the HR 1 changes that are coming to our SNAP program and our Medicaid programs and things like that. So we are trying to be proactive in how we look at all of these cuts. Ultimately, the legislature and the governor will be deciding what the cuts are going to be. So we'll put forward a list as an agency. We have to come up with a proposal for $372 million on our own. And so we'll submit those along with all the other state agencies. And then during the next session, they will go through a process and determine exactly what's going to be happening to the budget. I think I wanted to reassure you all that we have some guiding principles that we're using in terms of preparing our work. We're going to focus on our core services. And we absolutely are prioritizing the protection of the essential supports that we provide to Oregonians. We also know that we need to be stewards of all of the limited resources. So we're going to work hard at that by making really careful, transparent choices, around these really tough decisions. And then all along the way, we're going to be, as an agency, looking inward to say, how can we be more efficient? How can we spend our money better? How can we work better together? All of those things as well, just as an ongoing strategy in these, tougher budget times. We know this is going to be hard. And I think for the first time in a long time, we all have to just recognize that we are going to be making some nearly impossible choices as we work through this. And just know that we're feeling it. I know you all are feeling it, and we're all going to feel it even more. And I guess I just wanted to acknowledge that. But where you come in is that we do have a survey that we're asking you to participate in so that you can weigh in on areas that you feel are important about our budget. So I think we're going to put the link in the chat if we haven't already, so that you all can do the survey. And we highly encourage your participation in this. It's a great way to get your voices into the mix. We don't have a lot of time to do this work, and we're doing our very best to do community outreach in all the ways possible. And this survey is one of them. And if you could do it before the 20th of October, that would be really, really helpful. Over the next coming weeks, we're going to be gathering input from you all, from our leaders, from staff. Liesel, the acting director, is going all around the state talking to folks about what's important. So we're going to gather all of that up, and then we'll put the list together for the governor to review. And then we'll find out what the end result is in the short session. So that's really the process that's happening. Thank you in advance for your time and your care and your ideas about all of this. It really matters that we hear from you. So appreciate that ahead of time. And happy to answer any quick questions if I can. And then otherwise, I'm going to turn it back over to Catherine and James to talk a little bit about some of the federal implications briefly that we know about. All right. Take it away, y'all. Thank you.
Thank you so much, Claire, for being here. Appreciate that. And that link, that survey is linked into the chat, partners. So we, again, really appreciate your attention to that. And I know it's a quick turnaround, but we appreciate your help getting some feedback. All right. As Claire alluded to, I'm going to share my screen here. Share. Okay. And James, can you see that? I can see your face.
Yep.
Yep. Awesome.
Yep.
Okay. So I am here to give just a brief update. As Claire mentioned, it's a tough season we're all walking through right now. It's a tough moment. I think a lot of us, whether you're in the community or working for ODHS or a community member, Oregonian yourself, it's just wanting to take a moment to acknowledge the toughness that we're walking through. And we're not alone. We acknowledge that these impacts, HR1 impacts on the SNAP program that we're going to see first, it's inevitably going to put pressure on those individuals who will experience the impact the closest, who will see their benefit amounts reduce or close. So our commitment as we walk through these changes in Oregon is really just to provide you updates on these changes as quickly and also as streamlined as possible. So how we're doing that is in a few ways, but one of them is through more updates through the partner meeting, this space here. So just want to acknowledge the participation today is incredible, and we hope that only continues because we want to make sure this information gets into your hands to share with those that you're working with. So with that being said, this is going to be a very quick update, more so just wanting to provide you with the most up-to-date resources on these HR1 changes. These changes, if you haven't seen the news release, James, you want to go ahead and pop in those first round of resources?
They're in there.
Oh, awesome. Thank you. A news release went out September 30th, and we do also have talking points and FAQs that are available to use. Please do use as you're talking with folks who are concerned or worried or receiving notices that their benefits are being reduced due to the impacts of HR1. That being said, email communication went out to you all and our various partner partner listservs and groups last week out to key partners, letting you know the most updated information around these SNAP changes and the dates and the impact as we know it for the November 1st SNAP benefits. Text messages and notices will be sent next week, right around October 15th, to those whose SNAP benefits will be impacted for November 1st. And next line here. So some additional resources and information to share of how we will continue to be able to share updates with you as quickly as possible. We want you to stay connected by visiting our federal updates website. That's going to be the quickest route, even possibly quicker than the email that James or I send out to you with updates as they come. Those updates will also be available on our website. We also have a series of webinars, and we invite all partners and community to come and learn about what the changes are, what's coming next, what we're seeing, the impacts. And the next one is scheduled for Tuesday, November 18th. And we have a registration link, which I imagine is already in the chat for that. And also, as I mentioned at the very beginning, just wanted to reiterate that this is a great space to get information on the HR1 changes. We would like to dedicate some time to the updates as they're available during this meeting space, as well as the SNAP partner meeting. So if you're not connected into that partner space as well, we would love to have you. It's dedicated to food program updates from the SSP ODHS. And how to provide questions or feedback. We do have a feedback email there. Also, James and I would love it if you wanted to or felt comfortable to reach out to us even directly. So if you do receive or hear, or maybe you yourself have questions, please don't hesitate to reach out to us. We are committed to tracking those questions, making sure that we find a resolution, answers to those, and getting them back out to you, because we know often those come from the community and we want them to stay informed as well. I think lastly, there's a few ways, and these slides will be shared out with the minutes, but ways for individuals, Oregonians, to have access to information as quickly as possible as well on our social media, website, and news alerts. And then additional food resources. These are just a few, but we're making efforts to make sure that we're also keeping track of what food additional resources are available and making sure that you all have that to share out as well. I think that's it. I'm gonna go ahead and stop sharing here. And I think with that said, I'm 2 minutes early. Any questions? Again, I see Claire still here, for myself or James. Otherwise, we can get to our first, I guess, our next presenter. We already had a presenter.
Yeah, I realized we pulled a switcheroo, the agenda said, Yvonne, but we were obviously very happy to have Claire speak.
Thank you, James.
So our self-sufficiency programs director. So there must be some questions. Because if not, we will simply turn it over to Bill Bainey to discuss our next topic. But I see David, you raised your hand.
Hey y'all, so apologies it's loud. This is David Whelan with Partners for Hunger Free Oregon. Really appreciate the work you're doing. I think one of the ongoing things that can be really helpful to us as community partners would be to see some of the language that y'all are sending to folks like SNAP participants as they're receiving new information. I think in particular, we just want to be able to use the language that you're using and use it in a really timely manner. So on the 15th or so, we'd love to be able to reinforce that message with folks who call or end up with questions for us. Yeah. Not even a question, just a request. Thank you.
That's really helpful feedback, David. I wrote that one down and happened to work on the SNAP policy team that's developing those or has moved those through. So I can certainly follow up. And I imagine you're not the only partner interested. So we can follow up with the larger group. Thank you.
Yeah, that was part of the plan to get those out to you, certainly. But as Catherine was just saying, we don't have them finalized yet. Claire, you came off mute. Anything to add?
No, I was just going to say we've actually gotten that request from a number of folks who would like to, be sure that they know exactly what messages are going out. So I think that's just a brilliant idea, and we'll make sure. Yeah.
Yeah, I'd say Catherine and the team ran a really successful sort of community engagement group around communications with the summer EBT program, where we got to really consult and help shape. And we'd be more than interested in participating in that way that helps get out useful information to folks in these programs. And they know some partners would as well.
Yeah, I saw Sammy's thumbs up. I'm seeing a clap. It sounds like there is interest, and thank you, David. I agree. I thought that worked really well. So yeah, I'll bring this feedback up. I think even Maria Waters, who works with us in this work, is on this call. So I will echo those thoughts and that feedback, and could be really valuable. Thank you.
All right, Mr. Bill Bainey. Ready to
Hey,
talk
guys.
about SSP case management project work?
Yes, I am. I am. Thank you so much for inviting me to be with you. So, nice seeing some familiar faces and kind of seeing some new ones. My name is Bill Bainey, he, him, with ODHS Self-Sufficiency, overseeing some design implementation. And I'm here to talk to you about a project that I'm working on specific to the type of case management support that we're offering folks, and really looking at a demonstration project on vetting the viability and the plausibility of this model and what it looks like. But I want to talk to you a little bit around really the genesis of this, like what we're hoping to do and actually where we stand right now. So I'm going to walk you through a slide deck. Let me see if I can get you can see my screen. Can folks see my screen? Beautiful.
Yes.
Great.
You see your PowerPoint program.
Yeah. There. Presentation mode. Love it. Okay. So do me a solid, James, if there's something that pops up, because I can see you and Catherine right now. If there's something that comes up in the chat or I'm not tracking it, feel free. For folks who don't know me, I come from a big family and I welcome it when people interrupt me. It's kind of warms my heart. So if you do have questions and if you do have things you want to ask, don't hesitate just to chime up, and I'm more than happy to answer anything I possibly can. So I want to talk to you a little around what was referred to as the integrated case management project. And we're looking right now, it's being kind of started off here within self-sufficiency. In particular, it's starting in the TANF population and the TANF jobs eligible population. As we're rolling through this, you'll hear me say a few times, though this is the genesis of where this work is starting, this isn't designed to be limited to TANF only. Really, in the future, we're seeing how can this type of an integrated case management model be something that's relevant and germane to other populations as well that we're serving. And really looking at a model that's based on the needs of those we serve versus the programs that they're enrolled in, right? So really flipping the way of access to be much more reflective of the community and the family need and what that might look like. So give you a big picture. So why is this happening? So as we're kind of moving into this, this project is really an evolution about the work that we're doing. And so it's really evolving our current model around person-based and strength-based holistic approaches. And it's trying to be more personalized and connected to supports based on the unique needs and the goals the families have. So in lieu of saying it's going to be, a prescribed approach and a prescribed model and a prescribed dosage, it's really looking at personalizing this and tailoring it based on the goals, objectives, and preferences of those we're serving. Right now, we have case management, which is, I would coin like a one size fits all, if you will, that for folks that are coming into TANF, and in particular those that are jobs eligible, they received high intensive case management. And for a lot of folks, that's not working. For some families, some staff communities felt at times that it could either be confusing, sometimes even intrusive or overwhelming. And it's not necessary. That's not really what they're looking for. A lot of people are expressing in the feedback we've been getting is the need for assistance and support in navigating our systems and navigating access to the necessary resources in a timely way. Others just really want to get a connection to give me the name of a contact and information that I needed. That's what I'm struggling with, and I really just need that help right now. And how we're able to make sure that we're being nimble and accessible is really the most important part. So what this project's trying to do, it's trying to be much more responsive into that approach. So we're calling this as a tiered model, or you may hear of other times, you may have heard this referred to as a graduated approach of case management, and is really designed to offer right level of support at the right time and for the right windows, for the right reasons. Where this is also based on some of the work that we've kind of been hearing, and we've heard very clearly from our communities. And so often at times we've been asking communities, like, what are some of the challenges? What are some of the things that you feel would be fruitful and necessary? What are the obstacles? And we had in 2023, there were some kind of well-being initiative learning, listening sessions that happened in 23. There was also some kind of listening sessions that happened in 24. And then there was additionally come kind of Fair Boards was recently going around doing listening sessions. A key theme and universal theme, and actually all of those, was extremely complex system, challenging to navigate. Customer service wasn't effective, and it was really challenging to get timely access, especially for communities that often did not have access. And how do we try to mitigate that? So this is truly in response to some of the feedback that we're getting and how we're able to do it more intentionally. So the evolution of this model, it's really building on, I think, the work that self-sufficiency, in particular TANF, has done back in 2016 and 17. You may recall there was a transaction and a transition rather from more of a transactional approach into much more of a relational work, where it was looking away from the compliance to the policy or the compliance into the federal guidance. And it was starting to look at more of the connections and humanizing the work and finding the kind of obstacles that families are facing for that are kind of really serving as preventing for economic stability and well-being. And it's looking at a whole family approach. So we made that transition in 2016 and 2017, and that was the evolution of our kind of case management model that we have today. And I said earlier, right now, that one size fits all works, but it's not working for everybody. So as we're looking for kind of this a different approach to do this work, it's not a new approach. It's an evolution of the work we're trying to do. And it's an evolution that's building on the success that we've had about the relational work. It's building on holistic services that we're providing families. But this is also adding another component to that model, how we can go about doing this. So what a tier case management model, it really provides varying levels of support. So the way that we're looking at it, it's two specific approaches. And case management, there's typically, and folks may know this, there's typically four different styles of case management. The two specific ones that we're really looking at includes navigation or brokerage case management and high intensive case management. Um, we did this a deep scrub about an analysis of models that are happening around the country. We've looked at different states and the way that they've approached case management. We've looked at Colorado, Pennsylvania, California, Washington, to get a better feel for some of the models that they've been using and wanting to build upon some of the kind of successes that they've had. And some of the approaches that they've had often at times included this lighter touch navigation support and to get the needs of the families in a really quick way. So as we're looking at navigation, the navigation support that we're speaking to is offered at that initial point of contact for families. So it's an opportunity to identify what is necessary for family for stability. And it's really looking at, tell me, and it's like a very quick, accessible, and with the navigation comes a screening tool. And that you hear a little more about that in a second. But the navigation support is designed to address your immediate pressing issue today. and often at times if families would like more intensive case management, they always have the opportunity to have more intensive case management. But again, it's a family preference and choice if they want that intensive case management. But if they get that immediate need met through the navigation support, then we'll continue to stay connected with them. If they do need additional supports as a follow-up, we'll always be available to them. But this is truly a way to formalize getting families connected to those supports in a much more nimble way. Um, Again, our focus is really ensuring that families have timely, equitable, and kind of family-driven support. So the way that we're really designing this is ensuring that there's going to be equitable access and services based on the level of need they have. So within this model, there is, without question, consistent practice that is going to happen across all approaches that we have. And I'm going to talk to you a little bit around in a moment around our demonstration sites that we're starting to start off and starting to whittle down that approach. But right now, the way that we're doing our model and our case management, it's really only accessible to those families that are enrolled in TANF. And they're the only ones that have that long-term comprehensive support. And as we're developing this is really trying to alter the way that we're developing it, making sure that families get what they want, when they want it, and how they want it. We've met with a number of folks around the state to get some feedback. Most recently, there was some feedback that was happening through Chapin Hall, a partner that we're working with here in ODHS. And they were doing community cafes as part of the Oregon opt-in project. So it's really looking at the opt-in project is a project looking at for families that are screened out at that initial point of contact for the hotline and what kind of supports they would need. When they were doing the World Cafe, trying to get better understanding of some of those needs, clearly one of the biggest things they called out was early access to concrete and economic supports further upstream. How can they possibly get some of that connection in a way to mitigate some of the challenges and higher levels of acuity that they were facing? And so this is it kind of reinforces that mindset that we've been hearing is families, how do we get proactively further upstream those supports for families? And this navigation component would actually provide that to happen. The other feedback that we received that this model perhaps would be something we should be considering. We did some evaluation of our existing family assessment that is tied to our comprehensive approach. And the family assessment is this really detailed. It's 4 different domains, 22 different questions that are being asked to families. And we've been using this now for the last 5 years or so. We did a survey for over 3,000 families and asking them, and we did some community meetings and we got some staff input. And we really wanted to get some feedback about what they found was effective. Families found that assessment itself, though effective for quite a few, some families found it just wasn't really relevant to them. And they really weren't feeling as though it spoke to some of the challenges and some of the needs they had. Other issues they felt was that it wasn't culturally appropriate and they felt like it was intrusive. And for them, doing that sort of assessment wasn't really what they were looking for stability. What they really needed was some connection to those resources in a really effective way. So again, this is reinforcing all the feedback that we've been getting about all that work. So, yeah.
A question came through that you can address.
Yeah, sure.
Do you
Fire away.
understand this only applies to families? I know you said it earlier, but if you could repeat it. Who does this management apply to?
Good question. So this initial model, we're starting off with this initial demonstration site. So we have 3 demonstration sites, and I'll speak to that in a moment. But the model itself is it's a demonstration site being vetted and using as a learning lab, with the initial population being TANF jobs eligible as the first population being served. I want to take a moment and say, though we're starting with TANF jobs eligible, it's not designed to stop at TANF jobs eligible. We're using the existing population to be served, and it's ensuring that the model itself has the desired impact that we thought it would. And then if it does, continue to expand populations beyond that. But we felt it was important to start with the first population, and then we have actually a comparative analysis about, is this having an impact the way we intended it to? And if it's not, what kind of changes do we have to make? And or do we need to say, you know what, it's not working the way we thought it was, and we can move on. But it's going to start off with TANF jobs eligible. So thank you for the question. Other questions, James, before I keep on? Okay. Beautiful. Thank you. So please keep the questions coming. So as I mentioned earlier, we had a work group that was a meeting to help design the framework of this case management model, right? So we developed the framework for the case management model based on some feedback we got from other states. The case management model framework is really the findings of a number of people that are doing the work around the state. So we pulled together representation from folks that are working in the front desk in our ODH offices. We have case managers. We had representation from some community. We had multiple teams. We had leadership, administration. We've had policy. We had our research teams on it as well. And so they did a deep, deep scrub of all these different models. And I'm going to call out just three that they looked at that if you're interested, I can give you more information on them. One was a model out of Allegheny County in Pennsylvania called Hello Baby. And they used a graduated approach, and it was a graduated approach specifically for new and expecting parents and what those supports would be. It was universally offered, and it was an approach that they found was extremely effective, and it was vetted and researched by two different universities to see the effectiveness and the impact. Another project we looked at was linkages, and that was out of California, and it was a connection between CalWORKs and the child welfare system. And it was looking at a primary and a tertiary prevention strategy and what would be effective in that model. The third one we looked at was supporting families in strong communities out of Larimer County in Colorado. And they had a tiered model where it was a tier one case management was really roughly for 2 to 20 days, and a tier two was 30 to 60 days. Now, we were looking at, and the group is exploring, is like we did not want to just pull a model and an approach that was really appropriate or being used in other states, as opposed to how do we find what was effective, the components that were effective in those other states, and then also build upon the models and the positive and effective components that are currently in place within Oregon. And that was the kind of the design of the framework itself. The other thing you may have kind of recall from previous overviews, there is also kind of work underway right now specific to the transformation work and the ODHS transformation project. One of the things that we wanted to we were mindful of is not having a case management model or an approach or a project or efforts that weren't speaking and coinciding with some of these transformation work. So meeting with HSG, ensuring that the folks that are doing some of the transformation work were aware of the support. One of the key things that came out of some of the recommendations out of HSG findings and around the transformation work was the need for navigation support. I think there's a critical component of this, what that looks like, who's delivering it, and ensuring that we have a structure for it as well. We're also making sure that we're aligned with other efforts that are going on within ODHS. Examples, family preservation, I think some of the family first work, and some of the other work we're doing between child welfare and self-sufficiency. James, I see you came off mute. I'm assuming a question.
No, not a question, but you mentioned a lot of different programs there in HSG, and I don't know if everyone knows about all those programs and what HSG was.
Sure. So there was an external contractor that came in to help really do an analysis of ODHS and take a look at some of the recommendations for what the organization may look in the future, and really looking at a more of a child and family services continuum and what that might be, and really looking at, is there an opportunity to strengthen the supports along the continuum that we're providing our families? In particular, taking a look at, is there an opportunity between child welfare and self-sufficiency? Do we have this opportunity to deepen our collective work on behalf of the communities we serve, as opposed to having this fragmented, disjointed system? So they made recommendations to actually build what that system might look like. And the transformation project is really looking at what those strategies are, and is there the possibility, the viability of actually moving those into action and operationalizing those. So this is really, we wanted to make sure that we were in alignment with some of those recommendations, and as it's moving forward. So as we're moving along, it's not a standoff or a one-off, but it's tied to the vision we have for the future. Does that help, Dave? Love it. Okay. So as I mentioned earlier, we created a framework for this navigation and high intensity case management. But we also did not want to be presumptuous and say, here is a framework that was created, and now we're going to put it in action. So often you have this model that's developed, and we ask local offices or local communities to implement it. And what we're doing in a different way is much more of a collaborative design. We've identified 3 demonstration sites to really not only help build out the details of what this model looks like, but actually help with initial implementation. And the 3 demonstration sites we're working on, one is a Lebanon location. We have an office in Lebanon branch, Springfield branch, and Hermiston branch. And again, Their role is really to help define and shape the core elements of the model to ensure the practices and also the processes and the infrastructure in place to support the model are actually sustainable and accessible. The initial implementation phase is going to test not only the appropriateness of the model, but it's also testing to make sure that whatever is necessary, do we have the right data? Do we have the right training? Do we have the right reporting mechanisms? Do we have the right outreach? All of those components are going to be in place. These three sites were chosen very intentionally. There was an invitation for actually all districts within the state to submit a letter of interest if they would like to. We had 8 different districts submitting a letter of interest to say they would like to be kind of considered for this project. The 3 locations were selected based on their size, population served, the demographics, not only of their staffing, but also the communities they're working with, but also the region. So often we do work and it's quite often up and down the I-5 corridor. And we wanted to be very intentional, for instance, to make sure that the eastern side of the state was represented. So we brought that Hermiston over into this conversation as well. I see you, James. I'll wrap up. Thank you very much for that gentle prod. Okay, so a few things that we have going on right now. Let me see if I cut through this one. We have Araya is a vital partner in this project. One of the things that Array is helping to develop is a screening tool that's going to be associated with navigation. And so they're building a screening tool that's going to be accessible. It's based on some of the findings they had out of CDC and a number of other tools. That itself is going to be vetted and reviewed with the demonstration sites to make sure that it works. Outcome data has been identified to make sure that we are capturing impact. So there's going to be multiple threads. We have family outcomes, we're looking at community outcomes, and we're also looking at programmatic outcomes as well. As I mentioned earlier, jobs eligible is the initial model, but that is not going to be where it's going to end. The support we have for TAVVS and our survivors is not going to change. We're very explicit that survivor safety is paramount, and we want to continue that same pathway to ensure that survivors have the access to the necessary support. So this is not going to be part of our project. As we're looking at our outcomes, some of the proposed outcomes that we're looking at is less child welfare involvement for families that are enrolled in this process, improved economic stability, for communities, tribal governments and partners. We're looking at better coordination, stronger, more responsive customer support, and more growth in some of these local resources as well. And then as far as our program, we're looking at greater consistency in terms of practice. And also, is this the most effective use of our staff time and program resources? We're not going to be getting more staff, right? Is this going to be an effective use of the resource that we have? And how do we do this in a way that's going to maximize the resource we have without ever sacrificing the kind of services that we're providing the families that we're serving? We're also exploring technology options. Is there anything that we need to do for case management around the technology to make sure it works? And we can develop a wonderful model, but if it's not going to be sustainable through a funding mechanism, it's not going to last. So we're also looking around, is there the potential of an integrated funding formula? What could that actually look like? Is there a place we can look at full refunding? Training and professional development is also going to be tapped into that one. And that's the biggest thing. There's many more things. As you could tell, I could speak to this one for a while. So I just want to say thank you so much just for stop sharing on this one. Thank you for just giving me a few moments to kind of meet with you and share a little bit. Folks don't know me well, and some folks do. If you do have questions, please do me a favor. Never hesitate to reach out directly to me. You can either go to James or Catherine to get to me, or you can come to me directly. I'll be more than happy to talk to you, answer any kind of questions. If you have suggestions or feedback, if you'd like a little bit more insight about this one, I'd be more than happy to chat with you about it. I think this is a tremendous opportunity to do work in a much different way, in a much more intentional way. Okay, I'll stop there. Any questions or thoughts before I cut?
No, but thank you. That was a lot of good information.
You're very, very welcome. Thank you so much. Well, be well all, and I look forward to giving you an update again. I'll keep you abreast of what's happening. I'll periodically pop in and give you an update on how the project's unfolding. One thing I did not call out that I want to make sure I call out, James, sorry. We are also ensuring that community voice and family voice is infused. And so what we're tapping into is the existing structures that the 3 demonstration sites have to really bring that voice into it. So we're looking at contracted partners and our community partners to make sure that they're helping and design it and also aware of how this model is rolling out. because we can develop a great model, but if we're not doing it in partnership with our community, then it's not really effective. So we want to make sure we're the voice of those that are being served in the community, and the family is also infused. Okay, that for sure is the last thing I'm saying. Take care all.
All right. Well, thank you, Bill. And yes, please send your questions our way and your suggestions. In fact, I think I am question Bill shortly myself. But first, I'm happy to say that we have Amy Coven from Marketplace work to here to talk about changes that are occurring in the healthcare marketplace and give us updates.
Yes, hello. Thank you for having me, James and Catherine and everyone. It's wonderful to see some familiar names, but also thank you for having me and nice to meet you all that I don't know. I am going to go off camera because my internet's been super spotty today, but I just want to show my face and show that I'm a real person. And then I will just go ahead and share my screen here. So just give me one moment. And let's see here. Okay. Okay, I think you guys should see my slides now, yeah? We good? Okay, all right. So my name is Amy Coven. As James mentioned, I'm the Communications and Public Engagement Analyst with the Oregon Health Insurance Marketplace. We are, for those of you who don't know, we are an office within the Oregon Health Authority's Health Policy and Analytics Division. And the primary goal of the marketplace is to help connect folks with health coverage, especially folks who do not qualify for public medical programs like Oregon Health Plan, OHP Bridge, Medicare, VA coverage, etc., and who may not have coverage available to them through an employer. So seeing as you all are out there in the community helping the public, we want to make sure that you're aware of some things that are coming down and changing in the next few years. Just letting you know what some of these federal changes are going to have as far as impacts on the marketplace, and just kind of keep you aware of some upcoming things going on. And I'll move quickly to respect everyone's time. Um, so first thing that I just wanted to highlight is that starting August 25th of this year, DACA recipients, which are the Deferred Action for Childhood Arrivals, are no longer eligible for marketplace coverage. DACA recipients are also no longer eligible for OHP Bridge coverage, which is outside of the purview of the marketplace, but I think it's worth mentioning. And any current marketplace enrollees that are DACA recipients will be automatically disenrolled from marketplace coverage on October 1st. Or I'm sorry, I should say they were automatically disenrolled. Sorry, I don't know what day of the month it is. So this is a very unfortunate change. I do want to highlight and emphasize that if you are working with clients who are DACA recipients, of course, if their income is low enough and that they might qualify for Oregon Health Plan, there is always the Healthier Oregon program that's still available here in Oregon. And if folks are above income for Oregon Health Plan, they can still purchase health coverage directly through an insurance company. It is actually unlawful for an insurance company to deny or ask questions based on citizenship or immigration status. So folks do still have the opportunity to get coverage that way. But unfortunately, it does mean that they would be paying full costs without any financial assistance. So it's a very unfortunate change. Um, there's a lot on this slide. I'm going to go through kind of quickly because I know we're short on time, but there are some pretty big changes happening this year. I do want to emphasize, though, that here in Oregon, most of these changes are going to be very minor impact to Oregonians. The biggest change that's going to have that folks are going to see and feel an impact here in Oregon is that first bullet point, the non-extension of enhanced premium tax credits. So just as a kind of high-level overview of what that means, back at the beginning or towards the beginning of the pandemic, when the American Rescue Plan Act passed, and then under the Inflation Reduction Act, there was enhanced premium tax credits, which extended premium tax credit eligibility to folks at higher income levels. It also reduced the amount that people were expected to pay or contribute towards their monthly premium across the board. So this means that regardless of where your income fell, if you were eligible for financial assistance through the marketplace, you were going to get more financial assistance than you were eligible for in the past. This made health coverage more affordable on a month-by-month basis. These are scheduled to end. They have been scheduled to end at the end of 2025 since the Inflation Reduction Act. So this is not anything that is tied to HR 1 or any other federal provisions. We are calling it out because it's just not been talked about. It's not been included in any legislation. And so it's important for folks to know that this is something that is ending at the end of 2025. And we do know that there are insurance companies who are, the insurance companies here in Oregon are sending renewal notices, letting folks know of what their premiums are going to look like next year. And we are getting some calls from folks who are quite concerned because their premiums are going to go up quite a bit. We are seeing that this is especially going to be impactful for older individuals and individuals who live in rural areas of the state, both of those groups traditionally have higher premiums due to the way that premiums are calculated. So we encourage everyone to go to our window shopping tool and just take a look at what plan options are available because it's very likely that they'll be able to find a different plan with very similar benefits and coverage, but maybe save some money on a month-by-month basis. The second bullet, ending of eligibility for premium tax credits for non-citizens under the 5-year bar. This is specifically for folks that are under 100% of the federal poverty level. These folks will still be eligible to shop through the marketplace. They just won't be eligible for financial assistance. This will not really be impactful for Oregon because those folks typically are eligible for Oregon Health Plan benefits under Healthier Oregon. You'll notice that there's a number of different bullet points here that have some bold writing that says effective date pending final court ruling. Those specific provisions are not kicking into effect right away because of the City of Columbus versus US case. There is a stay that's been issued on those provisions. So those things are not going to be impacting the marketplace right away. And we will keep information up to date on our website as things progress and change in that court case. I would just say the other things that really I would like to call out that, folks might see a little bit or have questions on are the gender affirming care, which is not allowed to be an essential health benefit. Of course, here in Oregon, we do still have Oregon law, which requires gender affirming care to be covered and included in all Oregon plans. So this is not going to be impacting Oregon plans. So any clients who need that gender affirming care do not need to worry. That will still be covered. That special enrollment period for people under 150% of the federal poverty level is paused for 2026, but again, not super impactful for Oregon because we do have OHP Bridge, which goes up to 200% of the federal poverty level. So again, a lot of these things are really just not very impactful for Oregon because either we were already kind of, covering our bases before, or it's just stuff that it just isn't aren't things that we really have to worry about. Like we have really good insurance agents here in Oregon. We don't really have a problem with bad actors. So, having higher standards or different standards for termination isn't really a concern for us. So, um, moving to 2027, however, there are going to be some changes that will impact folks here in Oregon. The first is the removal of advanced premium tax credit repayment caps. What that means is that if someone applies for financial assistance through the marketplace, excuse me, when you go through the marketplace application, you're going to put in what you think your income is going to be for the plan year, which is going to be equivalent to the tax year. So, for example, if I go in during open enrollment, which starts November 1st, I'm going to be trying to guesstimate what my income is going to be for 2026. If I underguesstimate my income and I end up earning a lot more than I thought I would, and I don't go in and report that change, then the amount of financial assistance that I receive is going to be more than I should have received. And so in typical years, there's a limit on how much you would have to repay of that over however much you got more than what you should have. But that limit is getting removed. So this will be especially impactful for folks who, might be, sometimes folks don't want to go to Oregon Health Plan, so they'll put in that they're going to earn a higher income to try and stay on the marketplace, knowing that their income is going to be lower. And then they go to they should have been on Oregon Health Plan. So this would be impacting those types of folks where they shouldn't have gotten financial help because they should have been on Medicaid. So we just need to make sure that folks are really reporting their income as accurately as possible and that they're going in to report any income changes if they notice that their income is drastically different or very much different than what it should have been. And then the shortened open enrollment period is also going to impact Oregon. Open enrollment is November 1st to January 15th this year, as it has been in previous years. Starting next year, it will be from November 1st to December 31st. However, this will have a slight benefit to Oregonians that their plans will have to be active on January 1st. So it will actually have a little bit of an advantage for them as well. And then the ending of eligibility for premium tax credits is going to expand to refugees and asylees as well. So again, this is just kind of following a line with the DACA stuff that we were talking about before, that the administration is kind of, restricting access to health coverage for the immigrant population. So just we're trying to put together as many resources as possible so folks know what other options are available. And then last, I just want to mention that in 2028, so looking ahead a couple more years, we will be seeing the end of automatic re-enrollment. This will be a very big impact for Oregon because about 1/3 of marketplace enrollees are automatically re-enrolled from one year to the next. So this will be a pretty big change for folks. They will have to actively go into their account and re-enroll in order for their plan to start the next year. The good news is that we will be moving over to our state-based marketplace before then. So we will be able to take control and kind of do more outreach and education and hopefully guide people through that process a little bit more. But unfortunately, this rule does apply to state-based marketplaces as well, so we can't really get around it. Speaking of which, I just wanted to let everyone know a big update is that we are now officially in the implementation phase of our state-based marketplace project. We have a solution vendor, which is Get Insured, and we are very excited to be working with them. We have started really diving into a deep planning on our timelines and engagement activities. And our estimated go live date is November 1st of 2026, which will be for the 2027 plan year. The cool thing is that this system that we are going to be implementing is kind of an off-the-shelf system that we'll be customizing to Oregon. So we're very confident that we'll be able to meet this timeline. And if you have any questions or feedback or anything like that, we really encourage you to submit that. I will share these slides with James and so that he can send them out to you. But we have a number of different ways to stay up to date with the project. And this is a very, very exciting innovation for Oregon. So we're very excited. And then I know we're almost out on time, so trying to move quick. But I just want to let everyone know that when it comes to plan increases for rate increases for 2026, everything is pretty on par with what it usually is. If you're hearing clients talk about their premiums jumping up substantially, it's not actually because their premiums are increasing, it's because the financial assistance that they're receiving is decreasing. So just wanted to kind of set that expectation and let folks know. But folks do have a lot of plan choice available. Every county in Oregon has at least 5 insurance companies to choose from. So there's tons of plan choices available. we're really lucky here in Oregon to work with a lot of really great plans. And then last thing I wanted to say is just a shameless plug. We've got a really great monthly meeting. I will say it's a great meeting just because I host it, but that's just me tooting my own horn. But if you want to come and learn about our updates and dive into these a little bit deeper, feel free to join us. Once you register for one, you'll register for them all, and we would love to have you. It's open to any partners, anyone who wants to know anything about the marketplace. So come on down. And that's it. I'll stop talking. Fastest presentation ever.
That is a lot of information. I'm guessing people have questions, even though we are at time. Uh, Amy, I have one question. The
Yeah.
marketplace tax credits extension, is there any chance that that changed? Isn't that the source of the disagreement right now with the government shutdown?
Yeah, there's been a lot going on in the news about the enhanced premium tax credit. So that is exactly what you're hearing about. And we have a lot of legislators here in Oregon that are especially becoming more and more interested in the topic. So I'm very hopeful that Congress will be able to find some sort of you know deal or whatever, what have you. But that if you want to know more, I can share with you all also a fact sheet that we have about the impacts to Oregon, but it's pretty scary, unfortunately.
Okay, well, I want to thank everyone for sticking around. I know that we went a little long, but thank you, Amy, for the presentation. I also want to thank our interpreters, Susie doing ASL and Liz doing Spanish. Thank you so much. And we will see you again next month.
Thank you all. Have a good day.
Thank you so much.
Thank you.